Every morning, there's a 25-second stretch most adults over 60 move through without a second thought, and it may be working against their heart more than diet or medication ever does. It isn't food, it isn't exercise, it's something that unfolds in the first half minute after your alarm goes off, so automatic that almost nobody has stopped to question it. If your doctor has never mentioned it, that's not carelessness. Checkups are built around resting numbers, cholesterol, blood sugar, a blood pressure cuff in a quiet office. None of that captures what happens inside your cardiovascular system the moment your body shifts from sleep to awake. But cardiologists who study sudden cardiac events, asking not just why they happen, but when, have pointed at this same window for years. Here's the figure that stopped me cold. Fatal cardiac events are 3 times more likely in the first 3 hours after waking than during any comparable stretch of the day. Not a slight uptick. 3 times. A Harvard-linked analysis calculated that exact relative risk, and it's been echoed across cardiovascular research for decades. The reason comes down to a chain reaction that starts the instant your brain begins surfacing from sleep. One most people speed up rather than manage. Stay with me, because I'll walk you through what's happening in those 25 seconds, then give you a 4-step morning sequence that takes under 2 minutes, costs nothing, and works with your biology instead of against it. This channel focuses on one group, adults over 60, and the signals your body sends long before damage shows up on a chart. Tell me in the comments where you're watching from. I read everyone. Let's start with what's actually happening as you wake, because this rarely gets explained. Sleep isn't one flat state. The transition out of it is where your morning cardiovascular risk quietly builds. During deep sleep, your nervous system runs in recovery mode. Heart rate slow, blood pressure at its daily low, sometimes 10 to 20 points below your normal waking reading. Stress hormones suppressed, vessels relaxed. But as your body prepares to wake, your internal clock triggers a slow pre-dawn cortisol rise, and the real surge hits the moment you open your eyes. Peer-reviewed circadian research shows cortisol spikes by 38 to 75%, averaging around 50%, within 30 to 45 minutes of waking. Known as the cortisol awakening response, one of the most powerful hormonal events your body produces in a 24-hour cycle. Alongside it, adrenaline floods your bloodstream, raising heart rate and blood pressure and tightening vessels to push blood toward your brain and muscles. In a 40-year-old with elastic arteries, this runs smoothly. Past 60, 3 things change. First, arteries stiffen with age, and a stiff artery can't absorb pressure surges the way a flexible one can. Second, many people who feel perfectly fine carry plaque invisible on a routine exam, vulnerable enough that a sudden pressure surge can crack it and trigger a clot. In a coronary artery, that's a heart attack. Traveling to the brain, a stroke. Third, and rarely discussed, after 6 to 8 hours with zero fluid intake, you wake up meaningfully dehydrated, your blood thicker, with clotting factors at their highest concentration of the day. So when your alarm rings, you're already inside a window where your heart works against stiffer vessels, under hormonal surge, moving blood primed to clot faster than normal. And then most people do the one thing that makes it all worse, sitting straight up and swinging their legs off the bed in one motion. That's the 25-second mistake. It feels harmless because it's so mundane, but lying flat, blood distributes evenly and gravity barely matters. Go vertical quickly, and gravity pulls blood downward into the legs and abdomen, dropping blood supply to the brain fast. In a younger system, the baroreceptor reflex, pressure sensors in the artery walls, kicks in within 2 to 3 seconds, signaling the heart to beat faster and vessels to tighten. Past 60, that reflex slows, and blood pressure can fall 15, 20, even 30 points within seconds of standing. That gray, foggy, unsteady feeling after getting up isn't just normal aging. It's called orthostatic hypotension, defined by Research and Science Direct as a systolic drop of 20 millimeters of mercury or more within 3 minutes of standing, affecting roughly 20 to 30% of adults over 70. That means as many as 1 in 4 or 5 of you may experience this every morning without realizing what it means. Here's why it turns dangerous, specifically in this window. The compensatory spike your heart produces to restore circulation, stacked on the cortisol surge, stiffened arteries, and thickened blood, is exactly where vulnerable hearts break down. Studies tracking acute cardiac events show a cluster between 6 and 10 in the morning, not because mornings are inherently dangerous, but because of this precise convergence, triggered and worsened by standing up too fast. Consider a retired engineer, 71, who didn't take his health lightly, tracking blood sugar, logging blood pressure twice daily, on a statin and low-dose beta blocker for years, with a reassuring recent echocardiogram and a stress test showing no significant ischemia. One ordinary morning he silenced his alarm, sat straight up, and was making coffee within 3 minutes. His wife found him leaning against the counter, confused and sweating. He was hospitalized within the hour. It wasn't a massive heart attack. It was acute coronary syndrome, a partial blockage from a ruptured plaque and the clot around it. He recovered, but tracing the morning step by step, everything fit. The alarm, the fast sit-up, immediate movement, stiff arteries, morning blood thickness, and the compensatory spike that cracked a plaque, sitting silently for years. Nothing in his clinical profile had flagged mornings as his danger point. His medication and monitoring weren't wrong. What was missing was understanding that the shift from lying to standing is its own cardiovascular event. A third factor works quietly in the background: breathing during sleep. Mouth breathing accelerates moisture loss. Research shows water loss through expired air is 42% greater in mouth breathers than nose breathers, and even nose breathing over 6 to 8 hours causes meaningful fluid loss, an estimated half a liter to a full liter overnight through breathing and perspiration alone, with nothing replacing it. By the time your alarm sounds, you're measurably dehydrated, even without feeling thirsty. Think of your bloodstream as a hydraulic system. When plasma volume drops, fluid thickens, and the heart must generate more pressure per beat to move it. This has been documented since the 1960s, with hematocrit and blood viscosity measurably elevated in the early morning, confirmed again in a review published in Circulation Research, the Journal of the American Heart Association. Layer that onto stiffened arteries, cortisol surge, and sudden pressure drop, and the heart manages 3 added stressors in the same 25-second window. A fourth layer, a protein called PAI-1, plasminogen activator inhibitor 1, which blocks clot breakdown, peaks at approximately 6:30 in the morning, right at the start of the highest risk window per a study in the journal Blood, involving researchers from Harvard's Division of Sleep Medicine. The fix here is simple: a glass of room temperature water, not coffee, a diuretic that increases fluid loss, not juice, which spikes blood sugar, kept on the nightstand before your feet touch the floor. Bringing this together into a 4-point waking sequence, taking 90 seconds to 2 minutes, no equipment or cost. First, the stillness breath, 15 seconds. When the alarm sounds, stay flat and take 4 slow breaths. Inhale through the nose for a count of 4, hold 1 count, exhale through the mouth for a count of 6. That longer exhale stimulates the vagus nerve, the body's main brake on stress response. A study in Scientific Reports found this pattern increased vagal tone in both younger and older adults, with a notably greater benefit in the older group. Second, drink the water, 20 seconds, before sitting up, reaching for that nightstand glass while still reclined, giving your system a small volume buffer before gravity takes over. Third, the graduated transition, 45 to 60 seconds. Roll to your side first, rather than sitting straight up. Push to sitting using your arms. Let your feet hang, and rotate your ankles slowly in 10 circles each direction, activating the calf muscles, the body's strongest venous pump, to push pooled blood back toward the heart. A study on PubMed found 1 minute of ankle movement before standing reduced the blood pressure drop upon rising from a median of 17.5 millimeters of mercury down to just 1 millimeter of mercury in people with orthostatic hypotension. Sit at the edge of the bed for a full 30 seconds, then stand slowly, pressing through the legs rather than pulling with the back, and stand still for 10 seconds before the first step. Fourth, a brief temperature check, optional but valuable, noticing any unusual chest heaviness, shortness of breath, radiating pain, or a heartbeat sensation different from ordinary grogginess. Most mornings there's nothing to flag, and that's the reassuring baseline. But this habit means that on the morning something's different, you're already paying attention. For anyone on a beta blocker for blood pressure or heart rhythm, there's an added layer. These medications blunt the response to adrenaline, which also blunts the heart's ability to compensate for the postural pressure drop. The Irish longitudinal study on aging found beta blocker use alone was linked to more than twice the odds of initial orthostatic hypotension and more than 3 times the odds of sustained orthostatic hypotension compared to those not on the medication. This isn't a reason to stop taking a prescribed beta blocker, but it makes the graduated transition step essential, and any regular morning dizziness while on this medication is worth raising at your next appointment. Mornings aren't randomly dangerous. They're dangerous for specific compounding reasons happening in a narrow window: a hormonal surge, stressing artery walls, a sudden pressure drop forcing the heart to compensate, and blood thicker and more clot-prone than at any other point in the day. The sequence doesn't ask you to change your diet, medication, or evening routine. Just to place a glass of water on your nightstand tonight, take 4 slow breaths, roll gently to your side, sit for 30 seconds, rotating your ankles, and stand slowly. If this gave you something your last checkup didn't, share it with someone over 60 who needs to hear it, and consider following along for more research-based information like this. And, as always, please talk with your own doctor before changing anything about your medication, health routine, or morning habits, especially if you're managing an existing heart condition.